Hello everyone and welcome to the EVN podcast. My name is Irina Ghazaryan. I'm the editor of the creative tech section here at EVN Report. Our guest this week was Irina Ghazaryan, the co-founder and CEO of Dr. Yan. She joined us to talk about how her startup simplifies the process of scheduling and managing appointments for doctors and patients in Armenia. We also touched on Dr. Yan's additional initiatives, such as educating the public about specific treatment protocols and offering guidance on the recommended frequency of medical checkups. Lastly, we discussed creating venture-backed startups for the Armenian market and the potential for expanding these products to international markets in the future. Thank you for listening. Irina, thank you so much for being with us today.
Thank you for inviting me.
I'm really excited to talk to you today because I think this is going to be one of those conversations that I, again, learned the most from. I've been saying that a lot recently on the podcast, which is a good sign. But I want to start with a little bit of your background. Tell us what you studied, how you got started in this whole world.
Well, I will begin that. When I was, I think, somewhere around 13, I was sure I'm going to become a doctor. I really love the industry. My grandparents are all doctors. So I was even visiting my dad at his work. But then suddenly I started to draw and I dedicated all my days to just drawing, and I decided to become an architect. And that was a great decision for me. I really enjoyed studying at university. I did my bachelor's degree in architecture. And then a few years later, after even Dr. Yan started, I did my master's degree in urban planning. And I worked as an architect for somewhere around 3 years. I think that urban planning is one of the best things you can study because it covers so many different aspects of life, like besides just architecture. And I'm not a typical in terms of I'm not coming from tech industry, from a background. I'm an architect by background. And then after my son was born, I was mom at home and I wanted to work, and architecture is really hard to do remotely because you need to do site visits all the time, etc. And I didn't want to leave him. So I started learning UI/UX design. It was very easy for me because it's like a lighter version of architecture.
Right.
And
it's like digital architecture.
Yeah, digital architecture. But it fascinated me that how big the impact can be. You're designing a mobile app. It can be like somewhere 100 screens, but like thousands of people use it. And that part really captured my attention. Yeah.
Did you then start working in UI/UX?
Yes, I immediately started freelancing. I was quite lucky because I had great clients from all over the world. It was from US, from Canada, from Israel. And I figured out for myself that my favorite part is thinking the product out, like not just UI part, but thinking the product, understanding it. And during most of the project, I was quite involved in business decisions even because I got a really deep understanding of the product. And somehow one of my biggest projects that I worked on that project for 3 years was in healthcare field. I already had an idea of Dr. Yan, but it was just on a paper. And I got hired by a company that is based in US, and they were doing remote patient monitoring. And I think it was the beginning of 2020. It was already something about COVID, but not yet. And I had the idea of Dr. Yan, and somehow I was in healthcare industry 24/7, part-time working on that project and starting Dr. Yan. And I was in that project for 3 years. So I also got a great understanding of how healthcare in US works. So it was like a very good thinking.
Right. Yeah. Before getting to Dr. Yan, I want to ask you, so your background, as you said, is not typical for like a tech background.
Yeah.
Like, for example, I have a friend who swears that people who want to become entrepreneurs should all study physics because the problem solving involved in physics is applicable to all realms of life, and entrepreneurship fundamentally is just problem solving. Your background, like you mentioned, urban planning is very dynamic. It involves like several moving pieces. There's a ton of problem solving there. And then on the UI/UX side, you're not working in software engineering directly maybe, but you're gaining like a really deep understanding of how a user moves through a product, how the product should be designed in a way that is usable by the customer or the end user. How do you think of this from a more holistic approach of what type of paths lead to better entrepreneurs?
Well, I had an interview, I think, 4 or 5 years ago, and the interviewer was an architect who was building a product.
Yeah.
And we started talking because we were in the same background. I eventually didn't get hired by them, but he said, what do you think about architecture? I said, I think it's a constant problem solving. He said, yeah, I agree, because it's like you have a drawing and then you start talking to people from very different disciplines like plumbing, electroengineering, etc., and you start adapting their needs to your drawing. And eventually, sometimes, if you are not experienced enough, the final drawing may look very different from your initial idea, and you really need to understand their perspectives, and so you can have something that you're eventually proud of. And that's something that comes from, I think, from years of experience. So you can argue with them, so you can have your point and stand for it. So I think that background really helped me, because I wouldn't say I'm more privileged to have that background, because sometimes when I have always that feeling that when I'm in different conferences, I'm not tech person, I'm not doctor, but I'm standing for a product that connects both. But I think it really helps me to look at the problem from different perspectives.
Yeah, absolutely. Yeah. I think that's something that we could do a lot more with, especially in Armenia, because I think in Armenia we, more so in other places that I have experience with, we box people into their quote-unquote masnagituchun, their profession. It sort of doesn't let people to kind of expand and be a little bit more interdisciplinary in that sense.
Yeah, I agree.
So let's get to Dr. Jan. Tell us why you decided to start this company.
Yeah, as I mentioned, I'm coming from a family of doctors. My father and my grandfather are very, very dedicated doctors. So I've seen them working 24/7. And most of the time when they were already at home, they were answering phone and people asking, whom should I visit? I have this problem. I want to find a good, for example, dentist or someone. And they were just giving recommendations all the time. And one evening, I remember we were talking with my dad. I was saying that I want to build something on my own, not just designing it, but building a product. And at some point, I really didn't had a good understanding of how startups work, etc. I just wanted to build something on my own. And I was thinking about something that can be alternative to Goodreads or something like that, because I love books. I loved Goodreads, but it wasn't enough for me.
Right.
And then my father said, if we could do something so doctors receive less phone calls. And I think that sentence stuck to me. And I was thinking, well, but people really need to find a doctor. And so we should give them alternative way to find a doctor besides just asking their relatives or friends. And we started to work on that idea. I immediately started looking for co-founders who are more experienced and who can cover the tech part of the product. I was very lucky to find them quite soon. I think it was like a month after the idea, and we were really synced, and we are working together until now. We have quite different approach to many things, but it really helps the product to grow. And when we were planning our business plan, we couldn't imagine how big the COVID will be, because at that time it wasn't even widely talked about.
This is early 2020?
Yeah, it was, I think, January 2020. We couldn't predict the war that is going to start in September. So we immediately started working on a product. I think somewhere in June, we have the prototype to register doctors. And I started to go see doctors in different hospitals just to register them. And in September, we were ready to launch. I even had my first interview in September, I think somewhere on September 15 or somewhere around that. And on September 26th, the war began. And we had to freeze a little bit because we had at that moment somewhere around 100 registered doctors. But part of them went to COVID hospitals, part went to hospitals
for soldiers,
and we had to freeze everything. But we already hired 2 people, and it was a hard time for us. And 2021 was very turbulent for Armenia. I mean, we were planning some ads, some campaigns, and the day we wanted to launch campaigns, something was happening in the country. So we were growing, but very slowly, and mostly due to our network.
You mean the network of doctors? Or?
Yeah, a network of doctors, friends, telling each other, because it was really hard to use social media or anything else. Because when you were talking about something that is not war-related or COVID-related, it was nobody cared about it, actually.
Right.
Yeah, and I think in 2022, we started to grow. And we raised an investment. We won 2 grants. And I could already see that people are starting using it on their own. Yeah, and this year is quite big for us because I'm getting emails every Monday about the number of appointments completed last week. And in the beginning, it was very sad emails because it could be 15 appointments or 10 appointments. And now when I receive 100, 200 appointments completed, I can really see that we're growing. Yeah.
It's 10x.
Yeah, 10x. Yeah. It's
incredible.
Something unrealistic for me.
Right. Yeah. Going back to 2020, you said you guys already hired people. You're ready to go before the war started and everything. Where did the initial capital come from to set up Dr. Yan? Yeah,
it was our own fundings. Our co-founders were covering the tech part. We were covering everything else. During 2021 as well, we were all doing it I would say friends and family. And in 2022, we had a major discussion how this will go because we were not profitable. We had some paying doctors, but it didn't cover any of our costs. So we decided to try to raise an investment. And it's not easy when your product is local.
Because you guys operate in the Armenian market.
Yeah, currently we operate only in the Armenian market. And the healthcare industry that is quite conservative, it's not that innovative in terms of, it's innovative about surgeries, about methods of treatment, but it's not innovative in the way doctors and patients communicate, in the way they interact. In administrative stuff. And I was lucky to find investors. I actually pitched at STAN, FAST Foundation, Science and Technology Network, Angels Network of Armenia, and we got 7 investors. I was
7 angels from the network.
7 angels, yeah. And at that exact time, we won 2 grants. One from GIZ. We attended the Smart Gates Hero Houses pre-accelerator program. And we were one of, I think, 7 or 8 startups that won the grant. And we also participated in high-tech ministries program that was called From Idea to Business.
Right.
Yeah. And we won that grant. So it gave us some freedom to continue operating.
Fantastic. Curious, I want to dive deeper into the product, but since we're on the topic of funding, the work that you guys do makes the jobs of doctors and the healthcare industry in general much more efficient, right? Which is something that the state has a vested interest in, because if the jobs of doctors are being done more efficiently, it leads to better outcomes. And even for healthcare, it's a bit strange to think of it from economic perspectives, but even economically, it's better, right? Does the government locally, you guys mentioned that you had one high-tech grant, but specifically for projects like this, have you seen any interest from their side in participating and helping with things like funding and such? Because it does, at the end of the day, your success is much more directly tied to the success of the government.
Yeah, I had a couple of meetings with representatives of Ministry of Healthcare. They have their own product that's called RMED, that is made for primary care, and it's mandatory in some hospitals in terms of getting patients' health records, putting that into program, but they don't do what we do in terms of private sector and booking appointments, etc. We had a great couple of meetings. I wouldn't say they are interested in putting any funding in it, but we try to collaborate because we have some common missions. For example, we are very dedicated to help patients see doctors not only when they are ill, but for preventative care. So we recently added a functionality in the app that is called annual checkup, guide for annual checkups, where you enter your age and gender and you can get the personalized guide, which is one of their missions as well. They are working very hard, especially in rural areas, everywhere, so people can get their annual checkups, especially that many checkups are covered by the government. So it's just free for people to go and do their checkups, but they don't go. It's the matter of awareness, matter of it's time consuming very much. So we try to collaborate in this kind of things. But other than that, I think that many big hospitals in Armenia are private, and doctors in that private hospitals are more or less on their own. So they do their appointments by themselves. They have ownership of whole their schedule, etc. So, and they are our primary customer.
The doctor.
Yeah, the doctor. If the doctor succeeds in getting more patients, having more productive day, the hospitals become the winner as well. But since most of the hospitals are private, we are more into collaborating with private sector, not government.
I see. Yeah. And when approaching venture capitalists and angel networks and things like that, what kind of feedback have you guys gotten about building for the Armenian market? Is that something that they seem interested in, or are they more reluctant?
I would say they were enthusiastic into investing in the company that is trying to solve, firstly, a real-time problem. We're not very much into the future, building something that people will need in 10 years from now, but we're at this moment solving the problem. But they were also asking many questions about our expansion, about how are we going to enter new markets. And it's both very... I would say stressing to try to focus on two things, like expanding in Armenia, but also planning for expansion. But it also gives you the opportunity to think outside of the box, because we get a lot of feedback from doctors. For example, can you add this feature? Can you add this feature? And sometimes evaluating if that feature is really is going to be really useful in the product is to imagine that, for example, you're in a different country. If that's something that's very unique for Armenia, maybe you should skip it for now and focus on more universal, I would say, features. So it's both good and bad.
Right, yeah. Especially, I guess, with healthcare, there are feature sets that are very unique to specific countries' healthcare systems.
Yeah.
Right? So you constantly thinking more universally is difficult.
Yeah.
Let's now talk a little bit about let's do like a walkthrough of how someone uses the app on both sides, on the doctor side and the user side. Tell us how it works.
Yeah, I will begin with doctor side. For example, I'm a doctor. I download the app. It's free to register. I add my contact details, my education, and my workplaces. I can add multiple because most of the doctors work in multiple places. And then I have to set up my weekly schedule once. For each hospital, for example, I'm working here from Monday to Friday from 1 to 5, and then, for example, a couple of hours in another place. And once my profile is set, I'm available for patients to see me. On the patient side, once I'm entering the platform, I can either search for a specific doctor, or I can browse them by their professions. Once I choose a doctor, I can see doctor's information, everything like education, workplace, etc., consultation price. I can see verified feedbacks from other patients, because only patients who have visited the doctor via our platform can leave a feedback. And then I see doctor's availability.
Sorry, how do you guys verify that they visited the doctor through your feedback?
I will get to this point. Sure. Now, after my booking request, for example, I choose a date and time, doctors get a notification that this patient wants to see you at this exact time. Doctor can either approve or decline it. And then they can also suggest a different time for a meeting that suits for him. And once it's my time and day to visit the doctor, once I'm at hospital, I should click on the button that I'm here. And doctors get a notification. If the patient doesn't click on that button, we do a follow-up call to see if he was there or no. And if doctor gets a notification but patient is not there, doctor just closes that appointment, indicating that he didn't see the patient. Yes, there is a chance to trick, for example, if doctor wants to gain some reviews, etc., he can do that. But I would say that more than 99% of our reviews are real. Yeah.
It is quite like a hassle if they wanted to go through with that all.
Yeah,
right?
they can. Yeah.
I understand.
Yeah.
Okay, so that's on the doctor side. Then what about on the potential patient side?
In terms of...
So as a patient, I can sign up and I would just see the entire list of doctors and be able to pick who I want and stuff.
Yeah.
And is there or actually going back to the doctor side, is there a process of like onboarding and picking the doctors that can be on the platform, or is it open to anybody, any registered doctor?
Yeah, so any registered doctor can sign up. We're quite lucky now because if a doctor doesn't have a license, he cannot work in a hospital because it's quite strict now. So we don't check doctors documents, but when onboarding nurses, we do collect their trainings for past 5 years, their license, etc. Yeah, so doctors can register easily. Nurses have to submit some documents.
And are there other specialties like dentists and things like that on the platform too?
We cover all professions. We have psychologists, we have general practitioners. Yeah. Mm-hmm.
And is there information regarding like pricing and things like that on the platform as well to compare between the doctors? Yeah,
you can. If doctors submit, it's optional, but if it's most of the doctors put the consultation price. But if there are some treatments or procedures, they can just skip it and saying that depends on the procedure or on service. Right. Yeah, but you can mostly see the price.
Let's speak a little bit about the culture of visiting a doctor in Armenia. This is something, to be honest, I don't know much about. So, but in Canada, where I was raised, there's like in the US even more so, there's an issue of not visiting the doctor frequently enough. In the US, it's tied to things like cost often because everything is private. There's also just like, especially for younger people, there's a sort of sense of invincibility. You know, I'm young, I can't have health problems, but it often leads to just an overall issue with public health. It also leads to higher costs of like public health because the longer something goes untreated, it leads to bigger problems and things like that. In Armenia, what is the current state of the culture around visiting doctors, and how does Dr. Yan think about impacting that? Because it seems like if you guys are successful, you guys will be the primary way in which people make decisions on where to go and how often to go and things like that.
I would say that one of the major problems in Armenia is that most of the medical expenses are out of pocket, like a huge number, somewhere around 60-70%. And that's one of the major reasons why people skip visiting a doctor. And another thing is that there is a very low, limited amount of information about many things that can people like try to find to understand what's going on with their body in Armenian language. And we should consider the fact that even though there is a lot of information in Russian or in English, most of the people need specific information in Armenia, and we work on that side as well on our blog.
Create content.
Yeah, creating content for that. And secondly, and third thing, I think, is that people had very bad experience many times when visiting a doctor. It takes a lot of time. You may wait for hours in a queue, and then they just skip follow-up visit, which is a very big problem, because many patients just leave their diagnosis, like after receiving a diagnosis, they leave the treatment halfway. And they struggle then with that problem for ages. We sometimes receive some calls from patients, and they will be like, I had this issue for 2 years, and I finally decided to go see a doctor. So yeah, there are like many issues in terms of just going and seeing a doctor. And we started from that exact point where you need some help in figuring out whom to see and making sure that it won't take your whole day. And on the other side, why these things happen is because there is a very big, very tight competition in the domain for doctors. There is a huge surplus of medical specialists in Yerevan. And the picture is quite opposite in rural areas outside of Yerevan, actually. And doctors in Yerevan, many of them take quantity over quality approach. They see patient for somewhere around 3-5 minutes, and it's never enough for patient. And it reduces the quality of treatment. It reduces the patients' expectations, like they get expectations with reality. They hoped to see a doctor to tell them everything, but they have like 3 minutes, and they see that tens of people are waiting outside, and they get that pressure. And when I'm talking about this, the numbers show us that patients mostly like there are 3 things that they emphasize after seeing a doctor. Is basically quality of treatment. It's the easy communication with the doctor. Did they eventually understood each other? And was that easy to see doctor or not? These are the 3 major things that patients value when seeing a doctor. And right now, I would say that these 3 things are in a very hard condition in Armenia.
Yeah. Especially the thing you said earlier with doctors prioritizing quantity over quality. Is that just like a bad incentive structure because the more people they see, the more they get paid?
It is like that, but on the other side, as I said, most of the doctors are concentrated in Yerevan, and they are specialists that have very narrow specialization, and patients from whole Armenia are coming to see that exact doctor. So whenever I'm talking to them, he says, I cannot see a patient who drove like 5 hours to see me. I have to do something to see him, and that's a major problem. And when I'm talking with them about using Doctorian platform, their major concern is like, okay, I can book appointment for patients from Yerevan, but most of the patients, they just wake up and come see me. They don't even call to book an appointment. So yeah, that's a major problem.
Right. So it's both sides kind of.
Yes.
There also needs to be the culture
doctors
of
are
fully
really,
setting an appointment.
Yeah, their doctors are under pressure. I wouldn't say that it's just they like working this way.
Right.
Yeah.
Right. Well, that's good to hear.
Yeah.
Well, not that it's good that they're under pressure, but good that the problem isn't just misalignment of incentives.
Problem is bigger.
Problem is bigger. Yeah. Does Dr. Yan operate outside of Yerevan as well? All of Armenia covers? Yeah.
We have doctors outside of Armenia.
Outside of Yerevan.
Outside of Yerevan, somewhere around, I think, 50 or 60 doctors.
Okay.
But we are right now very much concentrated on Yerevan.
And how many doctors do you have in Yerevan in your network?
Somewhere around 700.
Oh, wow. Okay.
Yeah.
And what about patients?
We are close to getting to 20,000.
Wow. Okay.
Yeah.
That's incredible.
Yeah,
and
that's a big milestone for us.
How many appointments have you guys booked through Dr. Yan since starting?
Yeah, we already have somewhere around 7,000 finished appointments. And that number has significantly grown during this year. We launched, regarding the cultural thing that you asked, I wanted to emphasize this part. Doctors and patients are very much used to talk on phone. So even sometimes when patients book their appointment via our platform, they call to our call center to make sure that the appointment is booked and the doctor will see them.
They don't trust the...
they don't trust technology yet. And I've been talking a lot with doctors, and many of them who are very, very busy, they have a very busy schedule. They were like, I cannot trust everything to technology. I really need for patients who call me to get an answer. So we decided to step back a little bit from being just technological platform and to offer them services that is called personal assistant, where we get them a dedicated phone number that they can share between their all patients, and the patients call to our call center. So, and we do all the bookings and all the appointments. Doctor is happy because he knows there's a real person behind that technology who talks to their patients. And patients, I would say that more than 50% of patients who once called, the next day their booking is by the app. And this is a little bit compromising for us to have the technology, but also to offer something like very human to doctors, because the doctors will be like, it's been 20 years I'm working and I'm talking to patients every day and they really need to call me. I cannot skip their calls as there is someone needs to talk to them, and it's quite expensive to hire someone who is going to work from
like a receptionist.
Yes, something like a receptionist. So it's much cheaper to outsource that to us.
Right.
Yeah, and I would say that quite busy doctors who use our personal assistant service, they have somewhere around 300-400 patients per month.
Oh, wow.
Yeah.
Unique
patients. And most, I wouldn't even say half of that, but somewhere around 70% of that becomes an appointment. And that's a huge number. And imagine doctors were answering all their... Yeah. We save somewhere around 7 to 8 hours monthly for doctors. We talk that much on phone for them.
Yeah. That's huge.
Yeah.
It goes back to the efficiency point. Like, for example, in Canada, when I first learned about this, it was quite strange to me. But then I saw it in action and you really see the value. Like, the government heavily subsidizes the implementation of large-scale accounting packages, for example, for companies, like enterprise resource planning systems, to the tune of hundreds of thousands of dollars per company. But they know that the efficiency rate increases so much for that company by implementing a system like that the economic impact will be totally worth the investment that the government makes in those companies.
Yeah, that's so smart.
Yeah, so it'd be great to start adapting that within Armenia as well for things like Dr. Yan, but really just more broadly, because often we speak about what impact does tech have in Armenia. And we're often quite critical about that because most of the solutions that Armenian companies build are for the global market.
Yeah.
And the impact isn't really felt in Armenia, some say. And that's an argument that like we could have for hours. But in your guys' case, it's fully impacting the Armenian market, which is so nice to see. But the important point is that it's not so much like a tech sector impact. It's an impact on a different industry, which is, I think, is something often people miss. Like the impact of tech is on other industries, right? It's in the medical field, or it's in making something as simple as like the service industry more efficient or things like that. I really welcome it, and I hope we'll see more companies follow Dr. Jan's lead in that sense. Now you've been operating for about more than 2 years now, almost 3 years, I guess. Do you know if you guys have made an impact in terms of more frequency of doctor visits in Armenia?
I could say that in terms of follow-up visits, yes. Patients like immediately after when your appointment is finished, you can just click on schedule a follow-up meeting, which patients use a lot, because once you see that your appointment took like 20 minutes, you know that it's not like you can clearly see him in a month to check your results or something like that. So in terms of follow-up visits, yes. We also have a feature to add family members, and we can see that patients book appointments for their grandparents or if their children.
Right.
So yeah, I think that has an impact as well. The retention rate for us is a little bit hard to calculate because you may have problem once a year, or you can have like a treatment for 10 days. So you will schedule 10 appointments for 10 days, but then you can not see a doctor for a year. So it's a little bit harder, tricky for us to calculate how often they use the platform.
Right.
But I can see that once the patient has been onboarded, they mostly use the platform.
Again.
Yeah. Again.
Right. How big is your team now in Armenia?
So as I mentioned, the tech sector is our co-founders have an IT company. It's called Ghazaryan Solutions, and the whole tech team is at their office. We have recently moved to our office. We have been working remotely for almost 2 years, and in July we moved to office. Our team is right now 7 people, including me.
Including you.
Yeah.
And then the call center side is separate?
No, it's
within that 7?
Yeah.
Oh, wow.
Yeah,
okay.
we all work together. Yeah.
Okay. So you're like on the phone a lot.
Yeah. I just need to get out sometimes over the room because buzz.
Right.
Yeah, our office is not that big yet, but I think our call center will expand this year. So yeah, we'll see how it goes.
Nice.
Yeah.
Thinking about like the expansion of the product, are you guys already in the process of scouting new markets to enter with Dr. Jan?
Yeah, we are now in the phase of market research, and we try to understand which route is best to enter a new market. Will it be like white labeling? Will it be like franchising, or just doing the same as we do in Armenia? There are similar markets that have the same, more or less same problems, same approaches, same culture, but we are trying to understand by country by country. Yeah.
The white labeling is an interesting way that I hadn't thought about yet in this conversation. Is it something that you guys think, for those who don't know, white labeling would mean that the software and everything you've prepared, you would essentially sell to someone that would operate it in, or license it to someone that would operate it in another country?
We mostly think about hospitals or...
Oh, okay.
Yeah.
So the hospital would have their own...
platform.
I see. Yeah. Interesting.
Our platform is very well done. I'm really proud of the technology, how it looks, how it works. So I think it can be very useful for different organizations. To
so
use.
It's viable.
Yeah.
In larger markets like the US and Western Europe and stuff, do you find that solutions like this already exist and there isn't as much room for new entrants, or do you see a room for disruption there as well?
In Europe, there is a huge platform that is called Dr. Lip that does quite same as we do, and it's the biggest in, I think, it's the biggest in Europe, definitely. In the world, I will think about it, because Indian startups, killing numbers. So Dr. Lib is based in France, but they are already, I think, in Germany, in Italy, etc. And they operate very well. They are a huge company. They raised a lot of money, and I think all the doctors in France use Dr. Lib. So it's like a nationwide platform. Right. In US, the picture is a little bit different. For example, there is a platform that I really love that is very similar. It's called ZocDoc. And they were, I think, based in New York. I wouldn't say they are performing as well as Doctor.lib. I'm always looking at how everything goes, and but they are really good in terms of their visual part is amazing, their functionality, everything is cool. But in US, I think the insurance companies have their own platforms. That part is very well covered by insurance companies.
And they're usually tied to like a hospital network.
Yes, yeah. And in India, I was in India in February, and
the high-tech trip?
Seaside Startup Summit.
Oh, okay.
Yeah.
Okay.
And I was talking to someone from India, and he said, why aren't you entering India? I'm like, there is Procto in India that has 1 million doctors registered and 300 million patients. So I'm like, they are huge.
Yeah.
And he's like, what about the other 1 million people?
1 billion.
Yeah. He was like, these are small numbers. I was like, okay.
Different scale.
Yeah, 1 million doctors. I cannot imagine how you should even work with them, how big your team should be.
Yeah, seriously.
Yeah.
It makes me stressed just thinking about it.
Yeah.
Irina, thank you so much for what you do. I think there are problems that are universal, and often people think of it from a perspective of you have to go for the largest markets first, but this is a problem that every country faces, and if it makes an impact in Armenia, that's a fantastic thing, and then that impact can and should be exported outside of the country. Our last question, where do you hope to see Dr. Yan in 5 to 10 years?
In 5 to 10 years, I really hope that we had succeeded in Armenia. So we covered most of the territory of Armenia. Patients are happy to use us. Doctors love using Dr. Yan. And I hope we entered at least somewhere around 5 to 6 countries where we are fully operating as well. And maybe we can, our platform is working so well that we can sell it as a white label, as I mentioned. Yep.
I wish you a lot of luck with that, and I hope you'll come back again and tell us how that goes.
Yeah, thank you so much.
Thank you, Irina.
Yeah.